Okay, so now we are just going to discuss some kind of the abnormalities related to the cervix. If we talk about the cervix, some are the abnormalities that are related to the abnormality or the shape of the external os, and some are the abnormalities that are related to the entire cervix, the shape of the entire cervix, the size of the entire cervix. Okay, if we talk about the structural abnormality of the cervix can be S-shaped, but there is no cervix that is S-shaped. S-shaped cervix, it means that it is having the bend inside the cervix. If it is the complete S, it means that it is having the complete two loops. Such animal is not ideal for the artificial insemination, because if the animal is having the cervix of S shape, it will be difficult to pass the AI rod or any instrument inside the uterus to collect the sample for the infusion of the antibiotic or for the artificial insemination. So such animal can be the candidate of the natural mating. But as this is the developmental abnormality, structural abnormality, that is by birth, so keeping in mind the genetics, we have to avoid such animal to get you can say pregnant, because this can be transmitted to some other animals, and then you have just a limitation. Such cow is always only the candidate of the natural mating. You have not the, you can say, the high pedigree dose of the semen for this animal. You have to rely on some kind of the bulls that are available at your farm. So we cannot make the diversity in the genetic pool of such animal. Okay. So, but here these are the animal that is having enlarged diameter of the cervix, and this is the diameter of cervix that is abnormally enlarged. Plus, it is having some kind of the change in the texture. So, this portion of the cervix is larger than the remaining one. Okay, so it means that there are some cervical rings that are involved in this inflammation, and this one is the chronic inflammation. This is the chronic cervicitis. Okay, so and this is the texture is somewhat, you can say, fibromuscular. It means that some kind of the fibrosis is over here. Plus, it is indicative of that this animal is of the older age. So if you look at the ovaries of the animal that is of the, you can say, the old age animal, the ovaries will be look like that. If you are going to palpate, the texture will be different. Plus, the size of the cervix, it means that this animal may be having some kind of the problem with the cervix during parturition or after parturition, or maybe sometimes there are, you can say, rough manipulations during artificial insemination, and that is the, you can say, if the irritation to the cervix is continuously every month, is someone who is going to inseminate such animal and the technique is wrong, then it is going to make some kind of the injury in the cervix, and it can result after longer time in such a way. Sometimes the entire cervix is look like that, and if the cervix is entirely enlarged and somewhat narrow and tapering ends, then it will also known as the turnip shaped cervix. The turnip, what is turnip? Conglu, or very good. Turnip shaped cervix is actually the ideal shape for a case of chronic cervicitis. Okay, if I say only the word cervicitis, medically it means that I'm talking about the acute cervicitis. I'm talking about the acute cervicitis. If I say chronic cervicitis, it means that along with the size of the cervix, there will be change in the texture. Chronic cervicitis will be come with the enlarged cervix plus the fibrous or fibromuscular texture. The acute cervicitis will come with the enlargement of the size of the cervix, but the texture will be somewhat softer, or we can say the fluffy-like texture. Plus, the acute cervicitis most of the time come with metritis. Whenever the animal is having acute cervicitis, you will feel that there will be inflammation of the uterine horns, and the animal will have some kind of the systemic illness also. Okay? Any one of you, if having idea about the local uterine infections and the systemic illness? The local uterine, particularly the endometritis and the pyometra. When I say the local uterine infections, it means that this infection is not having entire system of the animal. They are just localized within the uterus, and they are just affecting the reproductive efficiency of the animal. If I talk about the problem of the uterus that are having some kind of the systemic illness, that is the metritis. When there is inflammation of the complete three layers of the uterus, and that is having, you can say, problem with the feed intake of the animal, with the temperature, with the pulse, with the respiration, and sometimes due to septicemia there is diarrhea also. So metritis will come with the history of systemic illness, but endometritis and pyometra are entirely localized uterine infections. Okay. So if we talk about the change in the shape of the external os, this animal is having the misshaped external os, because normally we say that it should be rosebud like this animal is having the rosebud shaped cervix external os, this animal is having the rosebud external os, and this animal is having the rosebud external os, but this animal is having some kind of the misshape or even irregular shape of the external os. So you can say that this kind of the external os will look like the cauliflower shape. It's no more the rosebud, it is now the cauliflower shape, the abnormal, you can say, shape of the external os. And such kind of the animal maybe have some kind of problem when you are going to pass the EI rod inside the external os. They can make some kind of difficulty, but you have to look for if it is the change in the shape of the external os, you have to manipulate the EI rod accordingly. Plus, in such kind of the animal, there will be always, you can, every time you are going to insert your tip of the thumb, the external os will be partially open, because the external os just has lost its tensile strength, and this will come with the history of dystocia handling. Mostly such animal will having multiple carving in history, plus there will be the history related to the dystocia once, at least once, and whenever you are going to pull out the fetus, that is known as retraction, okay, or traction, sorry, that is known traction of the fetus. Okay, so the hoof of the fetus or the extremities of the fetus sometimes make some kind of the injury when you are just pulling out the fetus from the uterus. Okay, so these animals will come with such kind of the histories, and then what is the result? And then these animals may have almost the uterine infections inside, and that can be the, you can say, the localized, maybe having some kind of the first degree of the endometritis, sometimes having the second degree of the endometritis. So they will have continuously uterine infection. Why? We know that the external os is actually the second barrier to the uterus. The first barrier was the vulva, that is not allowing any side outside the reproductive tract, that is in the environment. So it is not allowing the animal to get infection from the outside. The first barrier was the vulva, and then if someone is, if some bacteria is just getting inside the vagina, if they get some chance, then the next barrier is the external os, and the barrier will be okay if it is having the normal shape and it is opening at the normal time and getting closer at the normal time. So such kind of the animal, you can say, even if it is the luteal phase, even if it is the follicular phase, they are always having, you can say, partial opening of the external os. That's why they will be, sometime they may get pregnant and sometime they may not get pregnant. It means that sometime animal, if it is mild infection, the cow gets resolved itself. How? If it is cyclic one. For example, this cow is cyclic one. So every time when the cow is in heat, under the effect of estrogen, if it is the mild infection, it will make it clear by the, you can say, flow of the blood toward the uterus. By secretory activity, it is going to flush out the bacteria, and by the help of some contraction of the smooth muscles. So basically the estrogen is going to enhance the local immunity of the uterus. So maybe sometime it is, you can say, in normal in heat and can get pregnant, and in some cycles it is not going to, you can say, conceive normally. It is going to have 3 or 4 inseminations. That's why the fate can be in terms of slaughtering or culling. Okay. So this was the abnormality about the external os. Maybe the normal one is the rosebud shape, and this is the cauliflower shape. As soon as we can get some other abnormality, we will discuss in our some coming classes. So far now.